Percussion is a manual airway clearance technique that's used to mobilize secretions by creating a rhythmic force over lung segments. Before we begin, we must perform a safety screen. Percussion is indicated for patients with cystic fibrosis or pneumonia who have had difficulty clearing mucus. However, it's contraindicated if a patient has a platelet count below 20,000, an untreated tension pneumothorax, or unstable hemodynamics.
Come on, let's go look at some common pitfalls of percussion techniques. Hi, my name is Brooke. I'm going to be your chaos physical therapist today. Is it okay if I work with you?
I guess.
All right, well, I'm going to do some percussion on you today. Sound good? I'm just going to do it. I'll show you.
Stop. We never want to percuss over bare skin. We always want to use a gown or thin sheet.
Sorry for the interruption. Let's get back to our percussion.
Stop. We always want to use cup hands when performing percussion.
Like this?
Yeah.
Now that I've gotten the technique down, let's see what other parts of your body we can percuss.
When percussing, we always want to avoid sensitive areas along with lines and tubes in the area.
My bad.
Now, let's take a look at the proper positioning and technique for right upper lobe apical segment, assuming that the PT performed auscultation and found abnormal sounds in the region.
Hi, my name's Macy. I'm going to be your good physical therapist today. Is it okay if I work with you?
Sure.
Perfect. We're just going to get you situated first. I'm going to raise this up just a touch, and then I'm going to have you swing your legs around and lay back. Good. And I'm just going to put this under your legs like this. And then we're just going to do some percussion today for your right upper lobe apical segment. So we're going to begin performing some percussions, and I just want you to keep breathing throughout. I'm going to do about 100 to 480 percussions, and we're going to go for 2 to 3 minutes, and I just want you to keep breathing. Okay?
Mm-hmm. If we were to have found abnormal lung sounds in the middle lobe, we might put our patient into a Trendelenburg position like so, with the patient at about 12 inches of incline, and we could rest here for about 5 to 15 minutes, assuming that we had cleared all contraindications for this position. We could also perform percussion here if indicated.
So we're going to perform some percussions for your middle lobe really quick for about 2 to 3 minutes, and afterwards I'm going to have you cough and get those secretions out of your lungs. And I gave you a pillow here just so it's a little bit more comfortable when you cough. And afterwards, I want you to lean back and open your chest up, and then while inhaling, and then as you exhale, come forward, and you can give that pillow a squeeze and give me a big cough to get those secretions out, okay? So we're going to perform the percussions first for about 2 to 3 minutes. And I'm going to give you this pillow, and inhale big, and exhale out and cough. And at the end, don't forget to recheck your breath sounds to make sure your treatment was effective.